Welcome back. In today's video, we're going to cover some basic mobility training drills that will help to eliminate or alleviate some discomfort and pain from the lower back. So this video, you can tell this video is right for you if you're having troubles laterally bending through the spine. So if you can bend one direction but can't quite bend the other direction because of a pinch or a pain, then this is specifically for you. However, if you have discomfort in your lower back, your hips, or anywhere in this kind of hind quarter region here, this could also help to alleviate some discomfort with these following drills. So the first step is to knead the tissue or foam roll or use some self-myofascial release and massage therapy. I'm going to do that with my small roller here, and I'm going to do it against the wall. You could definitely do it on the floor if you're someone who's more experienced with foam rolling, but against the wall is fine too. I'm going to situate this foam roller in the small of my back and more toward the lateral side here, right above the hip bone. Soft tissue release or self-myofascial release, if you're not familiar with it, is just self-massage. So I'm just going to kind of find some soft tissue areas that feel tight and dense or feel a little bit more hypersensitive, and I'm going to roll around on them. So you can see here I'm rolling in a rotational manner so that that roller is pressuring in and across that lower back a little bit. Now I could get up and down and roll a little up and down here as well. I just don't find it quite as effective in this area. So I like the cross pattern roll here a little bit more. It affords me a bit more of a deeper massage in those low back muscles. Now it's important in this area to note that you're not going to put too much pressure in your floating ribs. So sometimes the floating rib area, especially for me because I have this specific issue a lot of times on my left side, the floating rib area is where the most sensitivity and discomfort comes around. So you can get close to that and roll and loosen up some of that tissue connecting right there. But you don't want to push in on your floating ribs too hard. You got your kidneys and organs in behind that, so you have to be cautious. Now you could take this all the way on to the oblique side or lateral side, so here on the side, and you could do the same. Right above that hip bone, there's some really dense tissue. It's where all your core muscles connect to your pelvis. And so you can roll that side a little bit. And you're basically just doing kind of a general sweeping of this lower back area, spending 3 to 5 minutes against the wall here, loosening things up. You can take it all the way into the lateral side of the spine where you have your big erector spinae muscles. Those are those muscles that run up and down along the sides of the spine, usually pretty strong spine extensor muscles. Try to loosen all that area up. Then we're going to go below the hip into the upper butt cheek. Spend maybe another 3 minutes or so working on that upper butt cheek, all the way from the lateral or the just outside the crack, medial side of your butt cheek, all the way through that high butt cheek to the side, right above ball and socket, and then you can get through the meaty portion of your butt cheek a little bit here too. So these glute muscles on the upper butt cheek and lateral side of your hip, those are usually some of the big culprits and problem causers in low back pain and discomfort. So today I'm going to pretend that I'm specifically targeting that left area, which is not uncommon for me to do because that's my area that I carry a little bit more tension, pain, discomfort. Probably stems from me being right-footed and more dominant in my right leg and more balanced and strong. So I'm actually, I assume, I don't know for sure, but I have lots of things that it could be. I'm assuming that my left hip isn't quite as strong neurally or muscularly, and that it causes constant weakness and constant overstress in that left hip, which leads up to my lower back, causing it discomfort. So right now I can find, oh boy, I found a little target spot right on the back side of my ball and socket joint here. This tissue right around in here, very tight and sensitive. That's a real common area. So I'm going to dig around in that for another minute or two. I'm not going to do that for your purposes. You can pause the video and take as much time on that foam roller as you like. If you hate the foam roller, chances are it's probably what you need the most. If you love the foam roller, then take your time, spend some extra minutes loosening up that hind quarter, low back, and glute. From there, I'm going to take you through some seated exercises. Since the restriction comes from our lateral bend, you may give this another try just to see how things are doing. And you can see my right side, I can dip almost all the way down. On this left side, I would feel a little bit of restriction and maybe a pinching in that lower back left side. And though foam rolling may have helped it already just a little bit. So now we're going to move on to a modification. Instead of laterally bending to stretch that, we're going to rotate. Those muscles also are responsible for helping with rotation. So I'm going to take my hand across, my opposite hand across the knee, my same side hand supporting at the hip, and I'm going to turn lightly, and I'm going to hold. Now from here, I'm not just pulling my leg across. I'm actually supporting myself to keep position. So I'm just maintaining a good position of that thigh bone and my rotation of my core. That becomes much more active than passive. So I'm not just pulling into a big twist. I'm actually squeezing, engaging these core muscles and pulling my ribs down in and tight and using the musculature to rotate. My hands are just here to facilitate and maintain good position of my thigh bone. So then I'll release off of that and I'll take that to the other side. Maintaining big abdominal contraction or engagement through that lower abdomen below the belly button and into the pubis or the pelvic floor, and then facilitating the rotation with my hands. And we hold it for just, 5 to 10 seconds. We'll do a couple more. 5 to 10 seconds. Engage that core. If engaging your core is something that you struggle with, you just can't feel that, I'd recommend going onto my website and checking out the Pillar Core series, where you'll learn how to really find what your core is and how to engage and strengthen your core, protecting your lower back, your hips, and pretty much control your developing your control center for all movement. So do a couple of those rotate and holds. They're more of an active exercise than they are a stretch. Now we'll move into more stretching. So the stretching that we're going to focus on is for the muscle groups around that area, not in that area. So those butt muscles, those glute muscles. For some of us, a figure 4 from the seated position is just not doable. So what I would have you do, a figure 4 stretch, is where you cross that heel or ankle over to the opposite leg. If that's way too much for you, first one modification is to sit back. Sitting back allows us maybe the space we need to be able to draw that up. If that's still not doable, no problem. I'll have you straighten out one leg, bring the other leg across, and just cross it right there at the ankle. That's one way to start, and then we can sit forward and we can actually pull that knee a little bit. From that light angle, we may start to feel that stretch. If that's not getting you stretched out enough, you bring that foot higher, you grab a hold of the shin, and then you do the same. You sit up tall, off of the back of the seat, and pull that knee in slightly. That should do it. If you're not feeling that, then you can probably come up to the regular figure 4. Easiest way to do it is to sit back, load it up. Any time that you're in a bigger figure 4 and bending that knee and crossing it over, I want you to keep your toes pulled up towards your shin. That's going to help increase structural integrity in the knee and protect the lateral side of the knee. So I'm loaded my toes up, I'm protecting my knee. Now I'm going to sit up big and tall, and there it is, a big backside glute stretch in that ball and socket joint all the way through the thigh to the hind quarter of your cheek here, and even into that lower back, which is why we're doing it, because that really affects the mobility of your lower back there. So we're going to do the figure 4 stretch on both sides. You've probably been in that position long enough now. 30 to 60 second hold. Ideally, maybe a couple sets of 20 seconds, a couple sets of 30 seconds. And here you can see, you may be able to see from the angle, I'm not sure what you were able to see on that first side, but my leg, first of all, it's easier to get it up there, and my shin almost goes parallel to the floor. Here, harder to get it up there, not quite as parallel, knee higher, that's the issue. Those are some of the issues showing themselves in that hip. So I'm gonna load the toes up, protect my knee, and hold that, that stretch in the glute and thigh. After about 20 to 30 seconds, I may relax, give it a second to relax and rest, and then I'll do it again. Totaling about 60 seconds is ideal for this stretch here. And then we're going to relax. We're going to kind of wiggle things about, see how we're feeling. We're going to retest. Let's go back to that lateral bend from the seated position. Pretty good, fine on that right side, which actually does give me a little bit of a stretch on the left side. Now I'm going to test out the left side. I'm able to move a little bit more. If that's the case for you, that's great. That shows that this is a good targeting therapeutic routine for that discomfort. If it hasn't helped you, maybe apply the drills a little bit longer or for a day or two more and see if it does help. And hopefully we're able to find some soft tissue flexibility that will help to eliminate some of the stiffness in the surrounding areas.